Welcome to today's Explainer. We're diving straight into a severe medical syndrome that literally transforms your body's largest organ into an absolute battleground. We're talking about erythroderma. You know, human skin is our ultimate shield against the outside world. But what actually happens when that shield doesn't just fail, but actively turns against us in a fiery, total body breakdown? Today, we're going to unpack the medical evidence, the visual clues, and the critical clinical steps needed to pull a patient back from the brink of this frankly terrifying condition.
Look at this number on the screen, 90%. That is a staggering diagnostic threshold. Erythroderma is officially declared when 90% or more of a patient's total body surface area is consumed by intense inflammation and scaling. Just think about that for a second. Almost the entirety of the skin becomes compromised. It loses its ability to regulate temperature, it loses its ability to hold in fluids, and it essentially leaves the patient completely exposed. So we aren't just dealing with a severe rash here. It is a full-blown systemic emergency defined by this massive surface area threshold.
Just look at the sheer visceral reality of this condition on the soles of the feet. The skin is literally forming these thick, rigid plates that peel away, leaving raw, highly vulnerable tissue right underneath. Patients suffering from this experience intense, continuous shedding. And because their skin barrier is completely broken, they suffer unbearable itching, they shiver constantly as massive amounts of body heat escape, and they lose critical fluids. It's really just a state of constant physical agony.
So, to solve this medical mystery, we're going to follow 6 investigative steps. We'll define the erythroderma syndrome, track the causes, examine the clinical manifestations, look at the dangerous complications, and finally, cover the treatment protocol and disease prevention.
All right, let's kick things off with Section 1, the erythroderma syndrome. The syndrome, not a disease.
So the crucial thing to understand is that erythroderma is a reactive syndrome. It's the extreme end-stage reaction of the skin to an underlying insult. That means anyone can technically suffer from it. However, the epidemiology shows a stark demographic divide. The syndrome predominantly strikes adults, specifically those between 41 and 61 years old. But what really stands out is the gender split. Males are disproportionately affected, with the male-to-female ratio reaching up to 4-to-1 depending on the study. While the exact reason for this heavy male predominance involves a complex mix of genetics and potential environmental exposures, it serves as a huge demographic clue for clinicians when a patient presents with widespread inflammation.
Moving right along to Section 2, tracking the causes, identifying the culprits.
If the skin is reacting this violently, what exactly is it reacting to? Well, the medical texts basically categorize our suspects into 5 main groups. First up, drug toxicity. This one is huge. Widely used medications, from beta-lactam antibiotics like penicillin to gout medications like allopurinol, can cause an explosive allergic reaction. Second, it can be secondary to pre-existing skin conditions that suddenly flare out of control, like eczema or psoriasis. Third, and perhaps most concerning, it can be triggered by severe internal blood diseases, specifically T-cell lymphomas like mycosis fungoides. Fourth, severe systemic infections. And fifth, primary causes, where it's congenital or idiopathic, meaning the cause remains entirely unknown.
Now, here is where it gets really tricky for doctors. Check out these 2 clinical cases side by side. On one side, bam, you have a patient experiencing a sudden, explosive drug allergy. On the other side, a patient whose chronic psoriasis has flared totally out of control. Despite having completely different root causes, one being an external chemical trigger and the other an internal autoimmune flare, they both ultimately culminate in this identical, terrifying, total body redness. The visual evidence alone just isn't enough. Getting a solid clinical history is absolutely everything here.
Okay, Section 3, clinical manifestations, gathering the evidence.
Beyond the obvious scaling we've talked about, patients endure fever spiking up to 40 degrees Celsius, profound chills, severe insomnia, and a level of itching that is frankly debilitating. And as this table meticulously categorizes, the damage goes way deeper. We have to juxtapose visible systemic distress against invisible laboratory alarms. Systemically, doctors might find an enlarged liver, hepatomegaly, which shows the body is fighting a massive inflammatory war, but the lab results reveal the hidden, life-threatening damage. Severe anemia, highly elevated inflammatory markers, and critically, a dangerous drop in albumin. That low albumin? It's a huge red flag. It proves that massive amounts of essential proteins are literally just seeping right out through the damaged skin.
Depending on the underlying cause we investigated earlier, the physical deterioration of the skin generally presents in one of two ways. It can be a continuous dry shedding, where the skin flakes off like powder or large dry plates, or it can manifest as wet scaling. This is a severe, weeping destruction of the skin barrier accompanied by heavy fluid leakage and localized swelling, which often points to conditions like eczema or aggressive infections. But make no mistake, both are clear, blazing signals of complete barrier failure.
This brings us to Section 4, Dangerous Complications, the ticking clock.
Listen, erythroderma is absolutely not a wait-and-see situation. The clock is literally ticking. The patient is in grave danger of cascading complications. Without the skin's protection, aggressive staph bacteria can easily invade, leading to sepsis or severe lung infections like pneumonia. Because patients are often bedridden from the sheer pain and weakness, they're at a super high risk for deep vein thrombosis, blood clots forming in the legs. Furthermore, the massive amount of blood flow redirected to the inflamed skin puts an enormous strain on the heart, which can trigger outright cardiovascular collapse, especially in older adults. Even the treatments themselves, like strong immunosuppressants, carry dangerous iatrogenic risks, meaning complications caused by the medical treatment itself.
Let's look at how we fight back in Section 5, Treatment Protocol. Protocol to save the patient.
There is no single magic pill for this syndrome, guys, so the response has to be highly tactical. The life-saving sequence starts with Step 1, immediate localized soothing, using cooling creams and gentle baths to provide relief and protect that raw surface. Step 2 escalates to critical systemic stabilization. This means instantly halting any non-essential medications, because remember, a drug allergy might be the hidden culprit, and rapidly replacing lost fluids and electrolytes via IV. Finally, Step 3 is targeted therapy for the root cause. If it's psoriasis, they might use specific immunosuppressants. If it's an infection, targeted antibiotics. It's basically stabilize the perimeter, then attack the root cause.
And finally, Section 6, Disease Prevention. Preventing future crises. Surviving the initial crisis, that's really only half the battle. Because erythroderma is notoriously persistent and prone to relapse over months or even years, doctors have to exercise extreme caution when prescribing widely used drugs, especially to patients with a known history of drug allergies. And for patients who develop the syndrome secondary to chronic skin issues like psoriasis or eczema, they have to adhere perfectly to their maintenance routines. Skipping just one topical treatment or ignoring an early flare-up can be the tiny spark that reignites that entire 90% body surface area fire. Diligence is literally their absolute best defense.
I want to leave you with this provocative thought to wrap up our explainer today. How does a simple, everyday prescribed pill, or just a minor skin rash you brushed off, cascade so rapidly into total body system failure? It is a stark reminder of how deeply interconnected our bodily systems truly are. Our skin isn't just a wrapper, it's a dynamic, vital organ, and absolute vigilance in medical care is crucial to keeping it intact. When it fails, everything fails. Keep this in mind the next time you look at the complex, incredible shield that is your skin.